Hello, I'm Maureen Swanson with the Learning Disabilities Association of America. I'd like to thank Pam Miller and Jesse and everybody with ACAT for inviting me to be a part of this wonderful conference. It's truly a privilege to be here today. I'm not going to share my moose call since I understand the bull moose are aggressive this time of year, and so they would all come running. Well, as I said, I direct children's environmental health initiatives for the Learning Disabilities Association of America, and I co-founded and co-direct Project TENDR, which is targeting environmental neurodevelopmental risks. And my co-director is Dr. Irva Hertz-Peixoto, who is an epidemiologist and professor at the University of California at Davis. And Project TENDR is really I like to think of it in a couple different ways as a breakthrough in terms of the alliance across sectors and the agreement on the science and what it says and the action that it calls us to take. Project TENDR is a group of almost 50 environmental health scientists, health professionals and medical organizations, government scientists, and children's health and environmental advocates. And that alliance is really well represented here today. Today, Pam Miller, Carol Kwiatkowski, Kim Gray, Ensei Witherspoon, Charlotte Brody, Elise Miller, Katie Huffling, and Janet Mon are all part of Project TENDR, and Brenda Foos from Ruth's office at EPA is also a participant in Project TENDR. So that's a subsection of that alliance that we have brought together. And Project TENDR, again, I see it as a breakthrough in terms of these different sectors coming together and reaching an agreement on the science. That the scientific evidence is at a tipping point. And, I think of what Lisa Wade said this morning about always being asked for more research and more evidence and more proof. And while it's extremely important that NIEHS and EPA are funding and continue to fund this research that is so critical to helping us know more and take action, in Project TENDR, these scientists and health professionals and advocates have come together to say, we know enough. We don't need to wait for more research. We know enough. We know enough to say that toxic chemicals are harming our children's brain development and that it's time for action. And specifically, multiple studies conducted on a wide range of diverse populations have repeatedly demonstrated that toxic chemical exposures, especially during prenatal development and in early childhood, that those toxic chemical exposures are contributing to problems with brain development and learning and behavior and attention issues. Those disabilities and disorders affect 1 in 6 children in the United States, and are increasing, especially we have increasing rates of autism spectrum disorder and ADHD. And I would wondered if, just with a show of hands, how many of us know a child with autism or ADHD or a learning or behavior issue? That's almost, I think almost everybody raised their hand. These disorders are way too prevalent and include intellectual disability, and as I said, autism, attention deficits, hyperactivity, learning disabilities, and other impairments to learning and behavior. Now, these are complex disorders. There are many factors. As we heard this morning, our speakers talked about the many different factors that come together and combine, including genetics, nutrition, social stressors. But what we're saying in Project TENDR is the contribution of toxic chemicals is a part that we can do something about. We can prevent that piece of the the increasing risks for these disorders. And can I go? And so our mission with Project TENDR is to reduce exposure levels of these chemicals or pollutants that are contributing to the risks for neurodevelopmental disorders as a means over the long term of achieving our public health goal of lowering the incidence of these conditions and protecting our children's developing minds. So how do we do that? How do we achieve the goal of exposure reduction and protect our most vulnerable, which is the developing babies and young children? With Project TENDR, we are taking a two-pronged approach. We have a consensus statement that, as Pam mentioned, was published July 1st in Environmental Health Perspectives. And the consensus statement targets and identifies a short list of chemicals that I'll get to in a few minutes that highlight the larger problem of toxic chemicals affecting brain development. Those chemicals are by no means, the chemicals that I'll identify in a few minutes are by no means the only chemicals that are harming brain development, but they are examples that help us make the problem concrete and provide milestones for success as we work collectively to eliminate and reduce exposures. And then we also say in the consensus statement that the system is broken, that these chemicals that already have harmed our children's brain development and increased their risks are really examples of our failure to protect children. You know, I think of Vi saying this morning that help is not coming fast enough, and it hasn't come fast enough for our children. And so we want to address the systemic problems in our regulation of these chemicals. And I don't expect you to read all those. Those are our consensus statement authors. This wasn't a document that people just signed on to. This is a document that more than 40 experts worked for more than a year to craft every word. And I'll make my slides available so you can see the authors. And then this is a list of some of the organizations that are endorsing the TENDR agreement, including the American College of Obstetricians and Gynecologists, the National Medical Association, the American Nurses Association. So there's our short list of chemicals that we are using and identified as prime examples of chemicals that have increased our children's risks for neurodevelopmental disorders. Lead, organophosphate pesticides, the PBDE flame retardants, which ACAT has done such a leading job of working to reduce the use of those chemicals and exposures, air pollution, and then we named phthalates, which are used in plastics to soften plastics and are used as they're contained in fragrances, in personal care products, and cleaning products, and cosmetics. And those were named as a category of emerging concern. And as I said, there are many other chemicals, perfluorinated compounds, arsenic, perchlorate, that are also putting children at risk. But we wanted to start with a group of chemicals that we could use to point to the larger problem, for which we have solid evidence of harm, and to which our children are widely exposed, and to which we also have confidence that we can reduce exposures and protect children's brain development. And then we call for systemic change, and then, you know, I think again, help is not coming quickly enough. And so the Project TENDR experts were not content, our first big step was to arrive at and publish our consensus statement and issue a call to action. But now we want to get to work in partnership with many others on ways to overhaul the system and improve our system of identifying chemicals that can harm brain development, and that pay particular attention to the vulnerability of the developing fetus and children, and that enable us to act before children are harmed by these chemicals, that speed the process by finding ways to regulate whole groups of chemicals and not just one at a time, and that end the cycle of replacing one toxic chemical with another. which flame retardants are a great example of that, where you get rid of the PBDE flame retardants, which are carcinogenic and neurotoxic, and then they're replaced with other flame retardants that are similar in chemical structure, Firemaster, 550, and other flame retardants that turn out to be just as bad. And in conclusion, our project tender, our consensus statement, was widely disseminated. It was published on July 1st, and the same day the New York Times ran an exclusive feature story. We had NPR affiliate stations interviewing a lot of our experts across the country. We held a congressional briefing that was attended by 60 House, Senate, and agency staffers, including staffers from Senator Murkowski's office, who are now in touch with us because they'd like to find out more about what we're saying needs to happen to reduce these exposures. And then we had an article that was just published on the tender consensus statement in the Journal of the American Medical Association. And I found out on Monday that the journal Pediatrics will be publishing an article on the tender consensus statement. So that's all to say that we have a lot of momentum, but we see the consensus statement and this agreement, this breakthrough, as just the first step. It's not an end in itself. And so our experts, our scientists and health professionals and advocates are committed to taking those next steps together. And that's through developing recommendations specific to reducing that short list of chemicals I talked about, to working to propose and help to establish a new process, a better process for identifying chemicals that harm our children's brain development, to continue to collaborate with policymakers and our partners across the country, to provide expertise and influence to the federal agencies that are regulating these chemicals, and to continue, we have another wave of major medical and scientific associations who are reviewing the consensus statement and will decide whether to endorse it or not as another means of disseminating this information and raising awareness. And we intend to continue to engage at all levels. And this conference has been a wonderful example of our tender participants helping us to spread the word. And for more information, you can visit our website or talk to me. I'm here both days, and I thank you for your attention.